All right, all right, all right. I'm Cameron Pulse from Performance Therapy Institute. Today, what we're going to do is we're going to talk a little bit about the 5 traditional reasons why a lot of clinicians, doctors, PTs, and as well as even patients, a lot of people think that they have back pain. And we're going to compare them or give them some different context to some more contemporary ideas. All right, so let's get started. So the first reason that a lot of people think that we have chronic low back pain is this idea of being out of shape. Now let's talk a little bit about the truth about that for a second, where there's a lot of information to suggest that a lack of activity, a lack of not, or too much time, specifically some of the research suggesting over 4 hours of either sitting or lying down during the 16 hours that we're awake, can really have some impactful bad health consequences. So there is a certain amount of truth to that. However, the idea that if we stay with the concept, this idea that we're simply just out of shape, our fitness isn't high enough, then what that can lead to is our decision making, and the decisions causing us to be like, well, we need to just have people work out more. We need to get them lifting weights more. We need to just have them just move. Even if you're in pain, just keep moving. We've seen over decades in different countries where they've tried doing that, and it doesn't seem to have a high level of carryover across many different types of people. So the context that we can change is maybe instead of just being out of shape is perhaps we need to create a safe environment for them to move in and have multiple repetitions within that safe environment to build some confidence. Okay, so carrying over that kind of old idea, and we're just going to move it to let's create a way they can work out without as much pain. Okay, and that's where having a really strong understanding of biomechanics can help us achieve that. Okay. So, item number 2, that the hamstrings, hammies in the back, and then the hip flexors, right, are too tight, and that's causing too much load on the back. So let's talk about a little bit about that traditional idea. All right. So the original idea being that if you needed to bend over, you need to pick something up, or if you were standing and you can't straighten your knees out, if your hamstrings are too tight, it's somehow creating some sort of pull or pressure in your back, like it's pulling on your back somehow. As we go into that on future dates, we'll see that that's difficult to even explain as to how that would be. Other than the idea if you're trying to bend over, right, you're trying to bend over to pick something up from a standing position, and the muscles in the back of your legs don't allow you to have it, that you'd have to end up bending more at your back. So, or the opposite, where if your hip flexors are too tight, that they're putting your pelvis in a position of an anterior tilt, and then that's causing to put extra strain across your hamstrings as you stand. So that's kind of what we can maybe take away and step and recontextualize that is that what if people just don't know how to turn their hamstrings from a concentric oriented position into an eccentric oriented position, or a shortened position into maybe an elongated position. Okay, but we'll use orientations a lot, mostly for various reasons that Bill Hartman and Zach Couples they give a lot of great reasons, why we refer to them as orientations rather than just a position, and I'll post that in the bottom of the blog here. Okay, but in terms of the hamstrings being too tight, maybe they just don't know how to turn them off. So maybe we need to teach them how to. Again, I'll post a couple of videos that we would start with how we'd start to get people to put their hamstrings into a more eccentrically oriented position, if that's what they need. All right. So reason number 3 is this idea of mid-range lumbar instability, meaning we're trying to keep this spine, if this is it, nice and tight right there all the time. And so if we go into the argument for lumbar instability, yes, is there such thing as spines and there a time and a place where perhaps a fusion is necessary? Yes, after trauma, that's definitely an issue. Or sometimes after repeated low-grade traumas, we have an anatomical compromise that perhaps needs some medical intervention. But for the most part, if we're always trying to hold on this idea where we need more tightness and our back should move always in this neutral position, if the spine were not meant to move, it wouldn't have all these different segments, right? It would just look like one long bone, perhaps like your femur, right? So it's meant to move. It's supposed to have some dynamics with it. So there's some truth to this idea of needing some stability when we're under load. But on the other hand, often people just don't have enough movement options in their back, and we're going to teach them how to do it a little bit better. So idea number 4, the acute disc herniation and degenerative disc disease. So acute disc herniations do happen. They can be emergencies, but they happen quite often, right? And I'm pretty sure I've had one myself, and I didn't have a particularly great relationship with pain at the time, thinking that pain often equaled some sort of pathological problem. And so with this idea of this acute disc herniation, it's good to be able to have some respect for the level of irritability that the person has, the pain that they're feeling. The level of threat is very, very high when something happens like that, okay? But it doesn't necessarily mean that after that's happened that their risk of low back pain is so high and they need to be very, very careful and take away all the things they enjoy in movement because of it, okay? And this idea of degenerative disc disease, well, if everyone over the age of 65, maybe not everyone, that might be a stretch, it can be diagnosed with degenerative disc disease, then what is the disease if everyone has it, right? It's about the same, I'm sure as you've heard this analogy, is most of us will get wrinkles as we get older. So disc degeneration is essentially is going to be as prevalent as having wrinkles, okay? And often those changes that happen in our back, and perhaps if we contextualize it, give it a different kind of concept, is perhaps as an adaptation that we've used to complete our daily tasks for the course of our life. Now, of course, if there are changes within the discs as we get older, just like in our skin, it's not going to be maybe as pliable. It won't have as many movement options. But still, by giving it more options rather than just trying to create more stiffness within a back that already doesn't have a whole lot of movement options, it doesn't necessarily bode well for the person that's trying to put their shoes on or go for a walk. And the last idea I'm going to talk about today is slumping too much, right? So while any position, if we take any body position and we were to hold it at the end range or close to it and not move it, that's not really a human thing. That's not really in any kind of mammal or moving creature thing, is to just sit in one position for a long period of time. Heck, even the flowers outside of my door, when I wake up in the morning, they're looking at the sun, and as the sun goes away, then the blossoms close down at nighttime. Sunflowers don't even stay in one position for the entire course of the day, okay? So slumping too much, yes, it's definitely not a great thing for your back or your overall health. Is it going to create a disc herniation or with irreparable damage in which you can never get back to do anything? No, probably not, right? I don't know if that's a great principle for us to be scaring into our patients, okay? So slumping too much, not great, but it's something that we shouldn't be telling everyone to just always be standing up super, super straight and tall the time, trying to create this tightness, just like I was talking about, that mid-range instability. All right, I'll post a couple of things that I like to do with people to try to get that concentric or eccentric orientation starting at their hips and their rib cage. I know I haven't spoken on that yet, but I just want to start opening up some ideas to say that these traditional ideas are not completely wrong, but if we can just add on to them, progress them a little bit, And I'll share some people, including Zach Couples, Bill Hartman, Lucy Hendricks. There's tons more out there in terms of resources that we can all use to start being better at our practice and working with our clients. All right, thanks.